Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, welcome to our clinic. How can I assist you today?
Good morning, doctor. I have been struggling with my weight for quite a few years now. I think I need a thorough consultation to discuss obesity and its implications.
Certainly, I can help you with that. Can you please tell me about your current lifestyle, dietary habits, and any underlying conditions you may have?
I lead a mostly sedentary lifestyle, and I think my diet is high in carbs and fats. I don't really have any known underlying conditions.
I see. Can you share your age and any family history of obesity or related conditions?
I am 40 years old. My father has type 2 diabetes, and my mother is obese as well.
Thank you for the information. Have you tried any weight loss methods or diets previously?
Yes, doctor. I have tried various diets and exercise routines, but I always seem to gain back the weight I lose.
This is a common scenario for many. Losing weight and maintaining it requires a sustained lifestyle change. Do you consume alcohol or smoke?
I drink occasionally and I don't smoke.
All right, let's discuss a multifaceted approach to managing and potentially reducing your weight. It will involve dietary modifications, increased physical activity, behavioral changes, and possibly medication. I will also run some tests to rule out any underlying conditions that could be contributing to weight gain, such as hypothyroidism or insulin resistance.
That sounds comprehensive, doctor. What kind of dietary modifications are we looking at?
We need to focus on a balanced diet with a proper mix of proteins, fats, and carbohydrates. Increasing your intake of fiber-rich foods, fruits, vegetables, lean proteins, and healthy fats, while reducing the intake of refined sugars, processed foods, and high-carbohydrate foods can help in managing weight. It's essential to control portion sizes and maintain a food journal to keep track of your intake.
And what about physical activity?
Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Activities like brisk walking, swimming, or cycling are good starting points. Strength training is also crucial as it helps in building muscle mass and improving metabolism.
Doctor, is it possible that there is some medical reason behind my inability to lose weight?
Absolutely. There could be medical conditions such as hormonal imbalances or metabolic disorders contributing to weight gain or difficulty in losing weight. I will recommend a complete panel, thyroid function test, lipid profile, and blood glucose levels to rule out any such conditions.
That makes sense. How about behavioral changes, doctor?
Behavioral interventions are crucial in managing obesity. These include developing healthy eating habits, engaging in regular physical activity, and adopting adequate sleep patterns. Additionally, stress management techniques like meditation and counseling can be beneficial in addressing emotional eating.
Is medication necessary, doctor?
Medication is generally considered when lifestyle modifications do not result in adequate weight loss. However, it's usually used as a last resort and in conjunction with diet and exercise. Medications are specific and depend on individual health conditions, and they may have side effects.
Thank you, doctor, for the detailed discussion. I hope to work on a structured plan and come back with positive results.
I am confident that with sustained efforts and a holistic approach, you will see improvements.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Jane. How are you feeling today?
I've been better, doctor. My eye has been bothering me a lot recently. It's so red and painful.
I see. From the initial assessment, it seems like you might be dealing with a condition known as uveitis. It's an inflammation of the uvea, the middle layer of the eye.
Uveitis? That sounds serious. What causes it?
Uveitis can be caused by various factors, including immune system disorders, infections, or exposure to toxins. Have you experienced any recent illnesses, or have you been exposed to any unusual environments or substances lately?
Not that I can recall. What does this mean for my eye? Is it going to get worse?
We will need to conduct some detailed examinations to understand the underlying cause and severity of the condition, and then we can decide the best course of action to treat it effectively.
All right. What kind of examinations are we talking about?
We will conduct a detailed eye examination, and we might also require some blood tests, skin tests, and possibly imaging tests to determine the exact cause of the inflammation.
And once we figure out the cause, how do you treat it?
Treatment will primarily focus on reducing the inflammation and relieving the pain. It may include corticosteroid eye drops or even oral medications depending on the severity. If there's an underlying condition causing the uveitis, we will need to address that as well.
I'm concerned. Will this affect my vision permanently?
If left untreated, uveitis can lead to complications including glaucoma, cataracts, or even vision loss. But detected and treated early, many people recover with little to no impact on their vision.
Oh, I see. I want to do everything I can to avoid any permanent damage. What should I do in the meantime before all the tests are done?
Avoid any eye strain, like reading in low light or looking at screens for extended periods, and try to protect your eyes from further irritation, like smoke or dust. Also, please refrain from self-medicating with over-the-counter eye drops until we confirm the diagnosis.
All right. And how soon can we start the tests? I would like to sort this out as soon as possible.
We will start the necessary tests immediately. It's important to address uveitis promptly to avoid any potential complications. I will ensure that we get the results back as soon as possible and discuss the best treatment plan.
Thank you, doctor. I really hope we can find a solution to this. It's been quite uncomfortable, and I'm worried about my vision.
I understand your concerns, Jane. Rest assured, We will do our best to identify the cause and start the appropriate treatment as soon as possible to alleviate your discomfort and protect your vision.
I appreciate your help. Let's proceed with the tests and hope for the best outcome.
Absolutely. We'll get started right away, and I'll keep you informed every step of the way. Let's work together to get your eye back to health.